Good afternoon, everyone. This is Dr. Vignesh Kumar. After a long time, I'm going to give a little speech on chronic low back pain. Recently, I have seen two important research questions which is not evidently proven. The two questions are while doing a movement during the pain of the back, is it harmful? Does we are doing any damages to the spine? This is a question. The myth is yes, the hurt is equal to harm. So don't do. Otherwise, you are damaging your spine. These are all the myths which is very commonly widespread among each and every individuals. But fact is the movement while you are doing during the time of the back pain, which indicates that the pain is increasing more, which indicates your spine is more sensitive, it is sensitized. So that is an important thing that we have to see in there. So the spine is sensitized. So while doing a movement like bending, twisting, lifting, all these movements can be do a little amount gradually. So once you avoid these movements, automatically your core will become more weak. So you'll be become more and more uh, disabled. So early movement is very important. So confidence to move early is very important here. So don't protect the spine. So as much as possible, we have to load the spine and keep doing the movement. So that while doing a movement, if you get a flare up of pain, so is it okay? Yes, definitely. Hurt is not equal to harm. So here movement is very important. Movement is a medicine. Motion is a lotion. I already told many times. So we have to do the movement for the spine which is more healthy. So that sensitized spine while getting a movement, your recovery will be faster rather than keeping immobile and taking hard bed rest for a long period of time. So don't get afraid or anxiety or fear because of this back pain, because I know very well the back pain which gives 100 kg weight which is tied on the back while you are feeling acute back onset. So even though you had to walk, you had to bend, turn, so little bit amount, if you get a flare up of pain, don't get worried. So gradually it will be reduced. So early movement is very important because it indicates the spine is getting sensitized. This is a fact here. Next question is, does I need to protect my spine during the movements? Does I need to brace my core during the movement? The fact is, it is wrong. There is no evidence for that. So don't protect your spine. Don't keep guarding your spine. You have to keep relax. Take a deep breath. Take a deep breath and relax the spine freely, and your abdomen and spine has been relaxed. So automatically if you do the movement, so gradually you can increase the movement. For example, forward bending, you want to lift something from the floor, first try by bending, by doing this relaxation breathing, taking from a half part, then try to the floor. If you want to do a gardening work, if you want to do a kitchen work, if you want to do a sweeping work, whatever that, you have to take a breath and relax. Then after that, try that. So the two important questions, hurt is not equal to harm, is a highlight of the answer. So you doesn't want to protect your spine while doing the movement. If there is a pain, so that you should not worry about. There is no mindset to get a catastrophic fear here. So you doesn't want to get fear while doing the forward bending or twisting or lifting, something like that. So this basic understanding is very important. Otherwise it may lead to anxiety, more anxiety, because our brain always tells the false perceptions prefrontal cortex, which stores the memory. As we get earlier, the same sort of a catch over the back. So it indicates it is a damage to the spine, hurt to the spine, but it is not. The fact is not. Your spine is sensitized. So try to understand it and don't protect your spine, don't guard your spine. You can do all movements. There is no evidence set like that. So lot of evidence are proving that biopsychosocial model, especially these type of education and cognitive functional therapy, plays the major role in alleviating this pain, preventing the disability, and also from the psychological issues and fear avoidance behavior and get back to normal. So, here my highlight is your spine is sensitized, not damaged. Thank you for listening. Keep watching my videos, which is very useful contribution to the society. Bye.